Hi folks, it's Dr. Berardi, and hopefully everybody had a great Thanksgiving. We had a patient call the practice about rhinoplasty or a nose job, and some people they ask, what is the benefit of one? Well, it depends on what you're looking for. The most common areas that we address with a rhinoplasty are the dorsum, which is here, and typically people don't want a bump on their nose, and that's something that we often see. But also there's the nasal tip right here, and there's various requests, whether I want it more refined or I want my nostrils to be different. So there's a lot of different things we can do for the nose. Many people have the common request of, I don't like my nose. And then we talk about it from a plastic surgery sense on what makes a beautiful nose. And these are all basically measurements and ratios, comparing the width to the height, to the projection, to the angles. It's something that plastic surgeons are trained to do. So when we do a rhinoplasty, we are resetting these lengths and these ratios to something that is more aesthetically pleasing to the eye. In some cases it's very dramatic, in some cases it's not. And I talk to people about the limitations of a rhinoplasty, and we talk about if someone's doing a working on a house, right, and they want to redo their house, you can do everything within the frame of the house or everything within the foundation of the house, but we can't really go outside that. So some of the limitations are, okay, what's the base of your nose and the length of your nose and the height? Some things we can't change, but we can change some of the widths of the nostrils or the width of the base of the nose, but there's some constraints. But we talk about this in depth. We talk about what to expect from rhinoplasty, and based on the patient's initial interest, what they don't like. Other things we do internally can address breathing issues, are one main one. How do we do this rhinoplasty? It's mainly through an incision that goes across the base of the nose, or this little structure called the columella. The remainder of the incisions are inside the nose. So we do everything. You don't have a scar that anyone can see unless they're standing in front of you and you're looking up at the ceiling. Even then it fades to almost nothing. Recovery, you can expect probably about 2 weeks to where you might have swelling, might have bruising. After that, it's a matter of just protecting your nose. Make sure you don't do any activities where you might get hit in the nose. So 2-week recovery. We watch you for about 6 weeks or so to make sure you're protecting your nose. And after that, it's everything back to normal.